Good morning, good afternoon, our viewers and subscribers. Today we are tackling geographic term. Do you have a geographic term? What is a geographic term? First of all, a geographic term, it has other names. Other names could be a wandering patch. Wandering, meaning moving from one place to the other. We have other names, for example, erythema migrans, meaning a migrating red patch. As you could notice, we have something called migrating or moving, or meaning it is not in one place. So what does that mean? Does it mean this patch? And you know what a patch means? Why does it call a patch? And why is it called geographic? It is called geographic because it seems to be having borders. The patches that are created, they seem to be having geographical borders. That's why it is called a geographic what? Term. So they are patches and they seem to be moving from one place to the other. So in other words, this geographic term is a harmless, it is actually a harmless condition that affects the surface of the tooth, creating patches that seem to be moving from one place of the tongue to the other. Now, the other name could be benign migratory glossitis. Why are we calling it migratory? Because it moves from one place to the other. Glossitis means it affects the tongue, or the inflammation of the tongue, or the infection of the tongue. Then benign, it is a word which usually means harmless, although when we come into cancers, we shall mean a lesion or a wound which is not cancerous. So what causes geographic tongue, or why is it a problem? First of all, before we go to what causes it, how does it present? So we have talked about the patches. You are going to see the patches as you can see in the what? In the photo, migrating from one place to the other. Does it really migrate? Usually the tongue is made up of bumps. So usually these are red and white bumps. So in this condition, the white bumps usually are wiped out and we only remain with red ones. So when the red ones are wiped, are remaining, you are going to see a map or a lesion or something like a wound on the tongue that is having what? Borders of the what? Significant borders. And that's why we are calling it what? Border. A border. Migratory glossitis. So once this place heals, another part is affected. That's why it is called migratory. That's why it is called what? Migratory. So sometimes that is sign number one. Sometimes also have pain. Some people have pain. Some people can also have sensitivity, especially when they take something acidic or something which is spiced. Will have what? Some sensation or some pain on eating those things. So anything acidic, it can what? It can be a problem. But the significant one, they are patches. And some other people, no pain at all. You are usually a dentist or some other person will say, what's wrong with your tongue? Or some people, when you come to a dentist, will open and you will see a tongue is what? Is having those patches. Or some people can brush the tongue and feel as if it is not clean. Only to check, the tongue has what? Has those maps or those borders. So that is what? A geographic tongue. Sometimes can be harmless, sometimes can be spiced, can be caused by spiced foods. So, and it causes what? Pain, especially on what? It causes pain, and if you're eating, sometimes it can be totally harmless. What causes it? The cause is actually not known. What we call idiopathic. The cause is usually not known. But there are other things which are related to it. Some people, it can be related to emotional stress. You know, there are very many things which cause stress, especially diseases, poverty, and other stresses of this world. It can lead to this one. It can also be associated with diabetes mellitus. It can also be related to low immunity. It could also be related to allergies. It can also be related to hormonal changes. But the real cause is not what? No. Without forgetting association with blood group O. So what do we do the moment you realize you have such a tongue? However much we are saying it is a harmless lesion, so it needs you to go and confirm with a dentist or a physician, because there are also other lesions or other diseases of the tongue which could easily resemble the geographic what? Tongue. So it would be good for you not to take it for what? For granted. So how do you treat it? When you have a geographic tongue, it may be harmless. It's not affecting you, and therefore you don't need treatment. But the moment you are a dentist treating this condition, depending on the signs and symptoms, we have to manage it symptomatically. If you need, first of all, to identify the cause. If they are spiced foods, you need to check in your history to see the new food that you have taken in or they have eaten that have resulted in this geographic tongue, and you can try to avoid this type of food. In a case you know there's any spiced food or acidic food that you have taken in and you have eaten and has caused this geographic tongue, you need to do away with it. Your dentist can as well write for you some gels or some medicine, especially gels to put. I will not give you a specific one here, where there are some we use, but in different countries they have different gels that you could apply to relieve some pain, so that you can continue using your tongue in eating what? In eating food. So you need to visit the dentist to tell you whether you need that treatment or you don't need what? Treatment. You also need to identify the cause, and most importantly, you need to maintain oral hygiene. So geographic tongue, this pain, it can be harmless patch on the tongue which causes or which brings migratory patches from one place to the other on the surface of the tongue. You need to visit the dentist, that's the take home, to make sure it is not the other lesions which may be harmful. Thank you so much for watching. Please subscribe to our channel and see you, or we can meet in the next video. Thank you so much.